Hey, this is Dr. Chris Kelly, and in this video I'm going to review the concept of a stress echocardiogram, what it is and what you should expect if your doctor has ordered one for you. So this is a very common test, and it's basically just an ultrasound of the heart at rest and after some stress, so usually exercise on a treadmill. It's done either in a doctor's office or at the hospital, and the goal is to help determine the probability that you have a blocked artery on the surface of your heart. And I'll tell you in a moment exactly what that means. In addition, because we're taking an ultrasound of the whole heart, it'll show us the heart's overall function, it'll show us how the valves are working, and uncover many other potential problems with the heart besides just a blocked artery. So when I talk about a blocked artery, what I mean is this. This is a picture of the heart. The red lines on the surface of the heart are arteries. They carry blood to the heart. The heart is full of blood all the time, and it gets it from the whole body through the sort of big red and blue tubes that you see faded in the background there. But the heart is made out of muscle, and the muscle itself needs blood flow to live. And the harder the heart is working, the more blood flow it needs. And if you have a blocked or partially blocked artery because plaque has built up in there over the years, then when the heart is working hard, it's not going to get as much blood flow as it needs to support strenuous function. So flow through a blocked artery may be fine at rest, but when the heart increases the rate and it's pumping more vigorously because you're running around a track, you need to increase the flow to the entire heart muscle, and if one of those arteries is blocked, it can't increase the flow enough. That's when you get symptoms and you feel off. When we're doing a stress echocardiogram, we can't directly assess flow through those arteries, but what we instead look at is whether the whole heart is contracting normally or whether part of it isn't contracting well, because if part of the heart isn't getting as much blood flow as it needs, it's not going to contract normally like the rest of the heart that is getting adequate blood flow. So we're looking for what are called wall motion abnormalities at stress, indicating inadequate blood supply. Now, to do the test, we connect you to the ultrasound machine with these wires here, which are measuring the electrical signal coming from your heart, so we can sync up the pictures, and we can also monitor your EKG for any changes that would be concerning for a blocked artery. We start with just a rest scan, so you lay on your side, and the sonographer, like this woman here, takes pictures for about 20 or 30 minutes of your heart muscle contracting at rest, and we determine whether the whole thing is normal at rest or whether there are abnormalities at rest too. And we also look at everything else. We look at the heart valves, the flow through the entire heart, and make sure there's no other problem. Then we have you hop on the treadmill. And for details on how the treadmill works, I would refer you to the general video about stress testing, but basically every 3 minutes the treadmill gets steeper and faster until you run out of steam. At the very moment that you run out of steam, you need to hop right back onto the bed within 10 seconds so that we can take pictures of the heart again. And now we're looking at the motion of the heart at peak stress. And again, those parts of the heart being supplied by blocked arteries or partially blocked arteries aren't going to have enough blood flow to function normally at peak stress. So we're looking for areas of the heart that contract normally at rest, but at peak stress are not contracting normally like the rest of the heart. And that indicates a blocked artery. And the more extensive the abnormality, likely the more extensive the blockage is. Okay? So generally this is a very safe test. There's about a 1 in 10,000 chance of a complication happening from the stress test, such as a heart attack or even death, but that's very rare. We try to screen patients very carefully to minimize this risk, and of course we have all sorts of equipment and medications on hand in case something happens. The ultrasound itself poses no risk to you. It's completely safe. So that's how a stress echocardiogram works. You should plan to be there for about an hour in order to get both the rest scan, the stress test, and the stress scan. It takes just a few minutes to catch your breath and recover afterwards, and then you go home. If for some reason you can't exercise, we would either refer you for a different kind of stress test or use a medication that raises your heart rate and your heart's contractility instead of the treadmill. So that's about it. Hope that was helpful, and good luck with your test.